My name is Dr. David Tom Cooke, and I'm an academic thoracic surgeon, or lung surgeon, esophageal surgeon, uh, anything related to thoracic oncology. In my particular practice, I care for a lot of patients who travel a distance to get their care at our facility. That includes rural patients, but even urban patients, but from a far distance from our center. So for me, we had a challenge of how do we coordinate that care? Can we prevent them from coming back to our institution with a simple problem, and even prevent them from being admitted or going to an emergency room in their local area with a simple problem that we could care for ourselves? In addition, I have a great academic interest in patient engagement and healthcare literacy. And what I like to do is be preventative in regards to complications after surgery. And that involves patient education, giving patients materials and instruments to help prevent complications before they happen. And I was looking for a patient engagement app to accomplish all of those things. In my practice, and in regards to my academic interests, I see CoreyHealth and CoreyPatient providing health literacy to the patient. So not only do they understand the disease process, because we provide educational content within the app itself, but it also allows us to deposit videos and other educational material so the patient understands what to expect before the operation, what to expect the day of operation, and what to expect around the operation, meaning the immediate post-operative days while they're in the hospital. So I'm a lung surgeon, and whenever I operate on the lungs or the chest, I really need the patient to come in and have their chest x-ray done. So when I see them, I can look at their chest x-ray and I know how well they are doing. Sometimes the patient forgets to get their chest x-ray before seeing me. I can built in notifications and reminders for patients to go get their imaging studies, whether it's a chest x-ray for our immediate post-op patients or a chest CT scan for our long-term cancer surveillance patients. This will remind them and make the visit that more efficient. For the type of surgery that I do, thoracic surgical oncology, one of the biggest risk factors for death after surgery is the development of complications. The most common complications after thoracic oncologic surgery are pulmonary complications, such as pneumonia, need for interventional bronchoscopy to reduce atelectasis or lung collapse, infection, and also blood clots, developing blood clots in the leg after surgery that can travel up to the lungs and create what's called a pulmonary embolus or lung complications in that regard. What we try to do for our patients is to empower them to prevent those type of complications. That includes walking at least 2 to 3 times a day prior to surgery, and we provide our patients with what is called an incentive spirometer, and that is a plastic device that encourages them to deep breathe, use their lungs, and to help prevent pneumonia after surgery. So through CoreyPatient and CoreyHealth, we're able to provide them with instructions on how to use an incentive spirometer, a video on how to properly use incentive spirometers. They can do that at home. But then we also provide them with automated text messages that reminds them to walk and reminds them to use their incentive spirometer and to deep breathe. I really see CoreyPatient as a way to prevent those things that really kind of drive us crazy in regards to the administrative application of health. And that's patient cancellations, patient no-shows. And the reason why I see CoreyPatient can help us with that, many of our, as I mentioned earlier, many of our patients travel from many distances. They may have difficulty with transportation. They may have difficulty in where to stay prior to surgery. To provide that functionality within CoreyPatient, such as links to drive sharing options, links to housing options, could really help us. Also, maybe a patient really shouldn't follow up with us for a long distance. Maybe all I need to do is look at their incision and then they're okay. With the video and picture messaging functionality with CoreyPatient, they could send me pictures of their wounds, and I could look at that and say, you know what, you're doing great, you don't need to come. So that is our goal. Our goal is to use this as a easy interface to record patient-reported outcomes. So ideally, we will see clinical, traditionally measured outcomes in our patients' successful recovery after surgery. But really, we want to know what the patient feels. What are their reported outcomes? And we have the ability to put in measures and metrics and other surveys within CoreyPatient and CoreyHealth so we could record those patient-reported outcomes. The key to modern patient care is really digital health. Digital health using apps, other wearables to help maximize the chances of patients for a positive outcome. I see CoreyPatient and CoreyHealth or CoreyMobile as an umbrella of products to really leverage and maximize technology to improve patient outcomes. Specifically, we want patients to be engaged and participatory in their own care, and CoreyMobile really allows that to happen.